the gateway to the West, Cardinal Nation. St. Louis, Missouri is home to some of the most brilliant doctors in the world. These doctors are pushing science to its limits, healing patients in new, innovative ways, and doing it at the same time they're teaching the next generation of doctors how to save lives. Meet Dr. Henry Randall, abdominal transplant surgeon, whose interests include 3D and 4D printing of transplantable tissue and organs. Dr. Chintilapati Varma, who specializes in children and adult organ transplants. And Dr. Bruce Bacon, a world-renowned physician and expert in hepatology and hepatitis C. This is the science of healing.
When I first became ill, we were on a trip and my back started hurting. I did not know what it was. It ended up being a kidney stone. We went to my doctor, my primary physician. She took some blood work and lab work, and that's when they found out something was wrong with the blood work itself. And that's when she progressed to say, I do not know what this is. They tested for leukemia, things like that. She says, I'm making you an appointment with Dr. Bacon. Dr. Bacon is one of the top liver specialists in the country. I am getting you an appointment with him, but it's in 3 months.
And we found after time that we always think the best is always worth the wait. And, we got the best.
So I first met Rich. He had been referred to me for further evaluation and management of chronic liver disease. He had cirrhosis, and it turns out that his cirrhosis was caused by an inherited condition called alpha-1 antitrypsin deficiency.
It's a genetic disease that I got from both of my parents. My mom had a bad gene and my dad had a bad gene, and I did not know this until I was 40 years old.
Sometimes it affects the liver, sometimes it affects the lungs, sometimes it affects the liver and the lungs, and sometimes people have the genetic makeup and they don't have the disease. Well, Rich had no lung disease, but he had the genetic makeup and he had liver disease. So
I think when they say, you have this disease and it's shutting down your liver, it's giving you cirrhosis and you're going to have a liver transplant. And they even told us you'll probably need to go ahead and get your affairs in order, if you have a house, making sure financially you are ready for this, because really I don't think we had any idea. So we put our house on the market. There were so many things that we had to do to prepare for this. And I think that was the shocking part of it is, what was to come.
And unfortunately, there's no real treatment for it. There's no, antiviral therapy like there is for hepatitis C. So we end up taking care of the complications of liver disease if they should develop, and that's where we were with Rich.
I don't think that you're ever ready for news that was something like that. Also, we had a 6-year-old daughter, and life was really good for us. Rich was a prison guard. I was a stay-at-home mom. Things were really amazing. So we thought, and so that was very scary because I was starting to process in my mind, how are we going to do this? For us, we had an amazing faith. We knew God was going to get us through it. We had no idea, but we knew he was in charge, so we were okay with that. So we just started asking for prayer. We just started preparing for whatever was ahead of us.
Manage things to a point, and then that management isn't as effective, and it's at that point that we decided to work him up and have him listed for transplant.
Oh, it's kind of a relief. For that feeling to actually be placed on the list, because it's not an easy list to get on.
It takes a large group of people to make that decision and come to the conclusion. And it's a lot of what I call, and I explain this to patients, I said when we get into this process, it's a lot of hurry up and wait.
I don't think people realize we got taken off the list several times. If you ever get too sick, they take you off, and that's just a heart-wrenching moment is to finally get on that list. And then there are times when you have to be removed from the list and put back on the list. And we were on the list 3 years, 10 liver calls. This didn't happen overnight.
You go to the hospital and you're thinking, is this the time? Is this the time? And you're always in the back of your mind thinking, okay, we can do this. We're going to make it through this. And then they come in and they say the liver was no good, or the primary accepted it, and then it's like a big letdown. There was many a nights we rode back home and not a word was said.
With transplant, what happens is we watch them get worse before they can get better, and that's takes a lot of maneuvering to get the medicines right and to make the adjustments to get where you need to go.
Actually, I was due to get discharged on the 5th of February. I had the discharge papers on my tray. And that morning I had texted her, knowing I was getting discharged. I texted her, and there was a chance I'm going to be getting a transplant this morning. Crying wolf. Dr. Nazal comes in, he says, "You're MPO, you are backup." So I have to call her after I've done cried wolf and explain this to her. She did not believe me. Okay. So her exact words were, "Get to packing, we've been in this predicament before."
We've been second before, let's get it.
Within another 10 to 15 minutes, Dr. Nazal comes back in the room. He says, "You've been bumped to primary."
So then he has to call me again.
So I have to call her again.
Well, I had a big old waiting room full of family, and they were all there, and every hour they would call. And so every hour on the minute they would call, and I'd run for that phone, and then they'd be like, "We've got him," and they would give us kind of an update. And it was funny because like one of the last calls, they were like 20 minutes late. And again, they'd always been on time. And so when they called this time, they said, "Hey, the new liver's hooked up and it's working fine." I go, "And you're 20 minutes late." And they busted out. They said, "Well, we were kind of a little busy, And I said, "Well, I understand that." But I said, I was so nervous because they had always done such a great job of calling. And anyway, so then we had to wait. And then Dr. Nazal would come out and he spoke to us. And Dr. Horton came out and talked to us and said he's not out of the woods yet. It was a big surgery. And the next morning they said, "You can come in now and be with him." And so I did that. Within 24 hours, he was sitting in a chair. 48 hours, he's walking with a walker. It was amazing. Who would have thought that you could have that major surgery and to be able to do that immediately? My favorite part was I was sitting at the foot of the bed with nephrology, and Rich was still out. He still has a breathing tube. He's still out. And the doctor said to me, "We hear you have a beautiful, amazing daughter, Madeline. He's always talking about her." And all of a sudden you see him doing this. And he starts, and then all of a sudden I said, "Oh gosh, I think he hears me." And then he starts doing this with his hand for me to come to him, and he was out. Just so sweet, because all he had to do was hear her voice and hear about her name, and he just wanted to come back to us. His thing was, how do you say goodbye to somebody that you don't know if you'll ever get to see him alive again? What are the words that you say? So all I said was, "You've never broken a promise to me yet. Today the promise is you come back to me." So when he woke up and I said, "Happy birthday, you did great," he said, "I didn't break my promise. I came back to you." And 25 years later, he's still coming back to me.
It's so gratifying to see all of our patients after transplant, because they've got a new lease on life. They feel good, their energy is picked up, their sense of vigor and their ability to do things has improved considerably, and it's really not only is it life-saving, but it gives people their life back to them.
The staff, the brilliance of those doctors and those nurses just astound us. We assume they go to school for these things, but there's so much more than just skill. It is a compassion and a love for their patients.
There's a team of people that are involved in the care of these patients. They're very sick when they come in, so they need a team of expert hepatologists, liver specialists. There are transplant nurses, coordinators I mentioned, the physicians, pre and post-transplant. The surgical team is a sort of an additional team of people that are vitally important, obviously, to the success of a transplant program. Dietitian, social work. We have to make sure people can handle we throw at them. It's a collaborative effort with the group.
Well, I mean, from the very beginning, they heard the good news with us, the bad news. They cheered us on when we thought we're done, you know.
Around the same time that I started Transplant, we had a birth of our only child. And, when he was 1 year old, I finished my fellowship. And at that time, when you go and see these kids, and they're same age as your child, you should think, oh my God, if my child had these problems, how am I going to cope with this? So I always look at a patient the way I look at my family. Like when I do a surgery, I always try to be as perfect as possible. Right down to the skin closure, my residents will tell you I'm fanatic about every single stitch because I wanted the way, if it was done on my child, that's the way I want it to be done.
We found out that he was sick when he was first born, and we first found out if we were having a boy or girl, so they knew at that point that he only had one kidney and that he was going to have some complications. And then when he was born, we realized how serious it was, and he went into kidney failure at 2 days old.
So Blake had a rare chromosomal disorder.
Yeah, definitely. As a family, it's scary. I mean, you go through a lot, and finding out your little one's got to be on dialysis.
From the time he was born, he spent many, many months along with his parents in the neonatal ICU.
And, he was super sick. He, threw up 10 to 15 times a day. He had a feeding tube. He was on dialysis anywhere from 13 to 24 hours every day. We were in the hospital 135 days. He had 5 surgeries. I mean, he was just so sick and in and out.
Delayed with
and just delayed with everything. He, didn't learn to walk until after he was 2. He never really learned to crawl just because of the catheter in his stomach.
And it took a long time to work him up completely.
So after he was officially listed for a kidney transplant, so at 7 months he was big enough, 25 pounds, to be able to go on the national registry. And we started a Facebook page for him called Brave Blake's Battle, and Lori saw it through a friend of a friend.
The moment I read that post and started to scroll through his journey, all I could think about was this sweet boy who should be learning to walk and crawling and enjoying life, and he was connected to machines about 20 to 24 hours a day. Right then, I just thought I can do something to help this little boy.
Who gave you your kidney, bud?
Lori.
Lori. Where's your kidney?
Where's your kidney?
Do you know where it went? Can you show her? Come here. Let's
Show her.
see. Peekaboo! Did it go in there? It went in there. It's hard to say how long he could have survived on dialysis. I mean, we don't really know, but it's very hard on a baby to have to be hooked up to a machine to survive. So the time was of the essence, and the sooner the better, definitely. Mm-hmm. So
My history with kidney disease starts in about 1993 when we found out that my mom was in end-stage renal disease from high blood pressure that had been uncontrolled. So she had a transplant in 1997, March of 1997. And I think that's also what led me to want to help Blake, because I saw my mom be very sick to the point of sleeping 16 hours a day and just having no energy, to within 2 weeks of a kidney transplant being healthy and having a new lease on life. And I just wanted that for that little 11-month-old boy that was connected to machines 24/7.
So from there, we connected her to the transplant team at St. Louis University Hospital, and they kind of worked with her from there. It was pretty amazing, huh?
That's really amazing.
It was really amazing.
We had many family members donate, but that is out of the bond which they have. But what is more amazing is that total strangers come forward and they say, we have 2 kidneys, I'm healthy, why don't I donate a kidney? They discuss it with their family, then they come and get evaluated.
It's like winning the lottery, and it's you're so excited that your son's gonna get a chance to have a normal life and be a healthy little boy.
Each step of the way, it just reassured me that we were both in very good hands. I think the day I met the surgeon, Dr. Varma, put me the absolute most at ease. When I walked in through the door to meet Dr. Varma, he made it very clear that he really wanted to take very good care of me, and that he took it very seriously, that this was an important decision I was making, and gosh, I just couldn't have asked for a better team.
So yeah, Dr. Varma and the SLUCare team was just incredible with us. You know, we met him early on in the transplant journey and just felt a huge connection with him. And he ended up doing both surgeries for Lori and for Blake, and just being, you know, super involved with him. And he just felt so comfortable with him, which is awesome for a little guy. So we're forever grateful to him and everything that the team there did for Blake.
And everything came together. I procured the left kidney from her with a minimally invasive, little incisions.
It was Martin Luther King Day, and so we call it, so it was MLK Day, so we call it My Lori Kidney Day for our family. So it was exciting, you know. They kept Blake overnight the night before, and we went over super early and saw Lori and her family, and we went over to see Lori and, you know, give her a hug and wish her well. And then we went back over with Blake. So Lori went back first and was in surgery for 2 hours, and seemed like forever. But when we finally got the call that the kidney was out and they were ready, they took Blake back.
And then we took the kidney across to Glennon, and we put it into Blake, and he just sailed through.
He went back for an 8-hour surgery with Dr. Varma.
He's not had, God forbid, any complications since related to the surgery. He's doing very well. And the donor is also a wonderful lady. I mean, she's marvelous. And everything turned out to be so good after. But there was a lot of hard work which was put in by the team, the coordinators, the transplant coordinators, the physicians, the nephrologists, and the NICU nurses and everybody, to just get him to a stage where he was ready for a transplant.
You know, we're just so grateful for everything that SLUCare did, you know, and they continue to do. You know, they're such a huge part of our lives, and, you know, them along with Cardinal Glennon, I mean, it's been like a second home.
I think we do a phenomenal job here, to be completely honest, and it has a lot to do with our team members. We've got exceptionally well-trained people from all over the country. The other part is the support that we get from SLUCare and from the university, and also our partners through SSM.
You know, we went from having such a sick little boy, so it changed everything in our lives. You know, no more dialysis, so we did in-home dialysis care. So, you know, Nick and I would, you know, clean out his dialysis catheter, and we'd have to do a sterile room, and, you know, we'd have to set up a machine every single night to hook our son up to, and that was the good part. You know, the hard part was being at the hospital and having him hooked up to a machine all the time.
24 hours a day
live, so.
until he got.
Yeah, it's changed our lives so much. I mean, we can just do normal things now.
Yeah.
To see him, you know, flourish and meeting all of his milestones, exceeding milestones, really.
He's learning new things every day, you know, as far as like eating and running and, you know, learning to climb on things and, you know, working with
nonstop.
Yeah, he loves to play and just be around family and just do all the things a little boy his age should be able to do. So
You don't derive any benefit from someone taking a piece of your liver or a kidney out of you. But the benefit is that you sometimes form a bond, or the bond between you and your recipient becomes stronger.
You know, there are times when people ask me, what's the best thing that you could describe, or what's the best thing that's come after we've had this surgery? Just the fact that I think my family is now extended. There couldn't be two better people in the world, and to join their family and just to feel like we have really come together as a family. And
overwhelmed with how much she's done for him, and how he is thriving and how he feels so good every day, and it's awesome.
Amazing to see.
Had it all to do again, I would do it again in a heartbeat. I still to this day see pictures of small children needing kidneys, and I wish God had blessed me with 3, because I would turn around and do it again in a heartbeat.
I was an undergrad at Michigan State, and it was, I was trying to decide what kind of surgery I wanted to do career-wise. And I was in an immunology class, and my light bulb came on. And I thought that's what I wanted to do, and I started pursuing it from that time, and here I am now. It's becoming a reality that you might be able to actually humanize a pig's liver, or you may be able to do 4 and 5D printing and actually print organs. But I'd say in the next 10 years or so, that's going to become a reality.
When I started fellowship, we were making a big cut on the right or the left side of the abdomen, cutting through all the muscles and fascia with a long incision, about 15 centimeters or more. And then once that is done, they stay in hospital at least for about 4 to 5 days. Once they're home, they have this big scar. Things have changed over the years, and everything is now gone laparoscopic. And so what we do is we now do what is known as a bikini cut, which is about 7.5 centimeters. It's like so big. It's a bikini cut and 3 little 1 centimeter cuts in the body. And the surgery takes about a couple of hours, and in 2 days they're back home.
And once he removes it from the body, I take it, I flush the blood out, clean up the kidney, and then take it to my own room where my patient is waiting. And typically what I will have done prior to that is make an incision and have the vessels exposed. And then I simply then take the kidney and put clamps on the vessel, sew it in, and take the clamps off. The kidney is reperfused, and we wait about 5 or 10 minutes. And before we connect the ureter to the bladder, we start seeing urine being produced. You know that the transplant you've done at that point is successful. So that part is exciting. And I tell you, the residents, either on anesthesia side or the residents working with us, they get really excited about that when they see urine.
I needed an organ transplant. I was a type 1 diabetic for many years, coupled with high blood pressure, and it just basically wore out my kidney. I was able to get a pancreas also, because if I didn't get a pancreas, then the same thing would happen in some years. I would need another kidney transplant.
This is not the type of diabetes where if you get it called adult onset, those patients do not do well after a pancreas transplant. It's the ones who primarily have an insulin deficiency.
I think before the doctor actually said, you will need a transplant, it's not anything that I had ever thought that I would be in the position that I would need. And when he said that, it makes you think, because the first thing that you think about is, you know, that's a major surgery. Will I make it through that surgery? What will happen if I don't get organs?
Long-standing diabetes can cause diseases of every organ system in the body. And she already had a kidney not working well. She was the ideal candidate to go ahead and give her a simultaneous kidney pancreas transplant.
The wait for the organ is stressful. You don't know when it's going to come. Everything is just kind of up in the air, and you're sick while you're waiting, and you're just hoping that you get that phone call.
You know, one of the problems we suffer from worldwide is just not having enough organs to be distributed around. People sit on the list for a long time waiting for appropriate organs or organs that are suitable for transplant.
When I received that phone call, I was actually at work. I was overjoyed. Actually, I just kind of started crying. I was surprised that it happened because I had received 2 previous calls that I may have organs, but the doctor decided to pass on them. He said they weren't in pristine condition.
And so the moment the kidney is out, it is flushed with a special solution, cooled down, and then it's transported to the recipient room, and it's immediately put in.
I honestly didn't realize how serious the surgery would be.
Well, afterward, I think she definitely had increased energy levels. Fortunate not to get on dialysis with I'm sure all her personal life, her family life, everything is all taken a 360 turn.
I'm here today. The outcome was an awesome outcome. I'm here today. I am no longer diabetic. I have no issues with high blood pressure. Everything has turned completely around. Healthy. I went to the doctor back in June for my transplant appointment for them to kind of check me out. And of course, I get my lab work done every month. And they called a couple days ago and said my lab looked great. So I'm very healthy. I've gotten my energy back. It's just the surgery, just everything that's wrong with you, it just kind of turns everything around.
She's doing fantastic. She went back to work sometime within the first 3 to 6 months after transplant.
I don't have diabetes any longer. I don't have to take insulin. My high blood pressure is gone. Every condition that I pretty much had, it just kind of reversed it. And I'm just healthy and able to live a normal life.
The diabetes itself, in long term, it can affect your eyes, it can affect your heart, your lungs, your liver, your blood vessels, atherosclerosis, peripheral vascular disease. Some patients end up getting amputations. So she's lucky she's avoided all of those things.
They did give me my life back, and I'm so grateful to them for that.
I became aware of Nikki prior to transplant. She works in patient access, so she does for her patients, what she herself had gone through. So she knows all about it. And I think that's amazing too, to be able to give back to people or give to people what you've experienced. Really sort of makes it hit home, I think, for yourself and for other people. But she's just been amazing to work with.
I do outreach here at the hospital for the marketing department. So I go out into the community to different health events, and I talk with the people and see what's going on, see if they have insurance, see if they need help, assistance with prescriptions, things like that.
She's a true transplant champion, if you will. She does what she's supposed to do, which is very important. She takes good care of herself, so she's kind of a model patient.
It's what I call the gift of life, and we are just what God selected to carry out that purpose.
In a small town like Vandalia, to have two people liver transplants at SLU, it's from a very small town. It is kind of amazing.
They've just done so much and just been an open book where we can ask questions, and and it's comforting too for us to know that we'll always have a place for Blake to go.
The follow-up care I've received, I get phone calls still frequently from SLUCare, and with Aaron and the transplant coordinator, I always felt like they had my best interest at heart.
And just everyone knows you by name. Hey, Nikki, how are you doing today? Or, even my nephrologist that I don't see anymore, the one that initially diagnosed me with chronic kidney disease, when I see him, he's, hey, how, he takes a minute to step aside to ask me how I'm doing. And you don't get that everywhere.
We run rates higher than the national average here. And the national average at 1 year is about 91%, and I think we're doing about 93% survival.
Great hospital and a great group of physicians.
Hospital,
It gives people new hope, new life.
And when you see the patient walking out of the hospital, no longer on dialysis, be it a kidney or a liver transplant, you just really are happy.